Good morning. I'm Hillary Armstrong, a Public Information Officer with the County of Santa Clara. Thank you for being with us here today as we announce a no wrong door policy for vaccinating residents over the age of 65 throughout sites at Santa Clara County. Joining us today, we have Dr. Sarah Cody, Health Officer and Director of Public Health for the County of Santa Clara, Supervisor Joe Simidian with District 5 of the Board of Supervisors for the County of Santa Clara, and Dr. Jeff Smith, County Executive with the County of Santa Clara. Our speakers will repeat the questions into the microphone for our Facebook Live audience. Following the conclusion of the English and ASL portion of the press conference, we will have statements from the podium in Spanish, Vietnamese, Chinese, and Tagalog. Thank you very much, and with that, I will introduce Dr. Sarah Cody.
Good morning, everyone, and thank you for being here as always. This is a ritual that we've now been involved with together for well over a year. Today, we are announcing that the county and many of our health system partners across the county will be offering COVID-19 vaccine to all county residents 65 years of age and older with no wrong door. So as you know, it's been almost exactly a year and a week since we announced our first case in a returning traveler from Wuhan. And now we have over 100,000 cases, and we are closing in on 1,500 deaths. 1,473 people, to be exact, have died of COVID-19 in our community. And we know that over 80% of those who have died are 65 years and older. So going forward, we must and we can prevent as many of these deaths as we collectively are able. So never did I imagine a year ago when we were all together that we would be where we are today, to have lost so many of our community members, to have our children at home on Zoom school, and to have our lives still totally upended. But then again, never did I imagine a year ago that we would be weeks into a vaccination campaign and have a safe and effective vaccine against COVID-19, and we do. So our challenge now is to roll out our vaccination campaign as efficiently and effectively as we can to get those vaccines into the arms of those who are most vulnerable and most likely to die of this infection. But given that we still have scarcity of this vaccine, we still have limited supply, and frankly, we still have a rather chaotic environment with changing state guidance almost daily, it's a challenge. But we're here to meet the challenge, and that's part of our announcement today, with a very simple message that everyone who lives in our county who is age 65 years of older can get vaccinated. There is no wrong door. You can come to any of the health systems. We are also committed to ensuring that people who live in communities in our county that have been hardest hit by COVID-19 have as few barriers as possible to getting vaccinated. And that means sort of two things. One is that we bring vaccination to those communities and that we bring people in those communities to our vaccination sites. And we're working with our community stakeholders on both of those efforts. So with all of us working together, I know that we can prevent more illness, and we certainly can prevent more deaths. And we are delighted to have everyone working together to protect our community. Thank you so much, and I'd like to introduce Supervisor Joe Simidian, who is from my district. I am his constituent. Supervisor.
Good morning, all. As you heard, I'm County Supervisor Joe Simidian. I represent the 5th Supervisorial District, which is the northwest portion of the county. I represent about 8 of the city's 15 cities and towns in whole or in part, about 400,000 of the 2 million residents of Santa Clara County. I wanted to say that our effort to get more and more folks vaccinated requires both simplicity and clarity, and we've had too little of both, quite frankly, until today. Today's announcement is a very important step in the right direction, and I think what I'd like to share with you today is the notion that if we say we're all in this together, we have to mean it. We have to provide access to the vaccine, and that access cannot be dependent on who your healthcare provider is or the number of vaccines they happen to have received in any given week. We've got to give every resident of Santa Clara County access to the vaccine, consistent with federal, state, and local criteria, and we have to do it faster. So while there will be many challenges to this effort in the coming weeks and months, I'm convinced that today's announcement really will get us there more fully, more fairly, and certainly faster. Now, just to put this in perspective with respect to the kind of numbers we're talking about, prior to today, under the state system, roughly half of the county's population was served by, and continues to be served by, what we call multi-county entities. That's the state term of art. What that means is that 1 million residents of the 2 million residents in this county were looking to their providers, Kaiser and Sutter, also known as Palo Alto Medical Foundation, to access the vaccine. And if in any given week, either one or both of those two healthcare providers didn't have the vaccine, that meant those folks were out of luck. As you've just heard from Dr. Cody, this no wrong door policy means that fully half, 1 million of the 2 million residents of this county who previously were unable to access the vaccine through our county are now eligible to do that. All 2 million residents of the county of Santa Clara, if they are eligible, if they fit the criteria with respect to age and circumstance, will now be able to come to our county or to their healthcare provider, but again, with no wrong door. So this is very good news indeed for literally 1 million residents of this county who now know that their access to the vaccine will not be dependent on who their healthcare provider is and or what kind of allocation they've had in the days and weeks prior. Thank you very much, and it's a good news day. Let me turn it over to Dr. Jeff Smith, our CEO, for final comments, and then, of course, happy to take questions if you have them.
Hello, thank you for coming today. Again, my name is Jeff Smith. I'm the county executive for the county of Santa Clara. And I'd like to talk to you a little bit about our county health system and how we're participating in this new initiative. The county health system in Santa Clara is the second largest public health system in the state, second only to Los Angeles. We take that responsibility very seriously, and we take our responsibility to all of our citizens in this county very seriously. The distribution and scarcity of this vaccine over the last month and a half has been really a huge problem getting the vaccine into the right arms. The state has been focused on distributing vaccine in smaller amounts to various agencies, and it's become obvious that the amounts going to Kaiser and PAMF are inadequate to care for their patients. Therefore, the county health system is now functioning in a no wrong door model. Effective today, any resident who's 65 or older, wherever they get their health care, whatever their insurance is, whatever their other healthcare needs are, can participate in the county health system's vaccine delivery program. At the same time, because there is a scarcity of vaccine and because we do have a responsibility to care for those who are at most risk in our community, We are focused also in a laser focus on communities of color and particularly subgroups of the community that are at highest risk. So in addition to the clinics that we have that are available to anybody in the public, we are also reaching out to those communities with clinics at the Mexican Heritage Plaza in East San Jose, at the Gilroy Community Center, which will be up and running next week, at the Gilroy Valley Health Clinic, at the Tully Clinic, at the Burger Drive location, at our Fairgrounds location, at Mountain View Community Center location, and at the Valley Medical Center Specialty Clinic location. All of those focuses will be on people who are in the greatest risk, the greatest need of services. So people who are 65 and older or qualify in other ways can go to sccfreevax.org and sign up and make an appointment today. With that, I'll end, and we'll have questions if anyone has questions.
Jeff, could you clarify the policy that you have to be a resident of a particular county to qualify? There might be tens of thousands of people who are bus drivers or grocery clerks who live in Hollister or Santa Cruz and spend most of their waking hours in Santa Clara County, where they're most likely to acquire the virus if they do get it. Is that policy workable? Do you see a change there?
We, through the county health system, allow people to sign up on sccfreevax.org who are residents of the county or who work in the county.
What is your vaccination capacity if supply is not an issue, and what is the state telling you about supply moving forward?
Well, supply is definitely an issue. We currently have enough on supply in our Valley healthcare system for about 2 to 3 weeks. We have been getting small dosages or small inventories of the dosages on a weekly basis from the state. And as we know from reading the newspaper, the state is developing a new system of dispensing. We're very hopeful that we will get adequate amounts to continue at our high rate of vaccination, which is about 6,000 doses delivered daily, Monday through Friday, and about 1,000 doses delivered on Saturday and Sunday. And we'd like to expand to about 15,000, which is why we're looking at other sites in order to do that. However, the big caveat here is we need to get enough vaccine. And the limiting factor in getting enough vaccine is the manufacturing. So we're ready, willing, able. We've got the infrastructure to do it. And all we're waiting for now is vaccine.
NBC? Thank you. You brought up both Kaiser and Palo Alto Medical Foundation. You know, Kaiser has canceled a lot of appointments down here, they say, because of a shortage. How much of today's announcement is sort of because of what has gone on with those major health providers?
Well, over the last 3 weeks, it's become clear from looking at the numbers and talking to the other health systems that the multi-county entities did not get a sufficient amount of doses in order to take care of their patients. As a matter of fact, Kaiser was, shall I say, shorted significantly, considering that statewide they represent probably about 40% of the population that's insured. So when we saw that Kaiser was forced to cancel clinics, we had to ask ourselves, how can we fix that? How can we intervene the best way possible? These people who are 65 and older, who happen to be Kaiser members, are at great risk. And so if they're at great risk, we need to do something about it. So that has a lot to do with our changing policy.
75 and older. How does this shift in policy, how do you ensure that people 75 and older aren't sort of elbowed out of the way by all of the 65 people trying to get the vaccine?
Great question. And the focus that we're using in the county health system is special outreach. So as I mentioned, we have numerous sites set up in communities of high risk. We've also been continuing our targeted mobile delivery into nursing homes and skilled nursing facilities. We're developing a targeted delivery system for those individuals who are homebound, and particularly elders over 75. And we realize that that group is at great risk, and so we're going to continue to push, particularly in the areas where there's high incidence of the virus.
Just a quick follow-up, if I could. It's my understanding that there was an estimated 120,000 people in the 75 and under. Do you have a rough estimate of the numbers of those folks who have been vaccinated or as a percentage?
A rough estimate of how many people have been vaccinated over 75 is about 37% of the population over 75 that have already been vaccinated, and about 28% over 65. So we still have a long ways to go, and we clearly do not have enough vaccine on hand to get there. But we have assurances from the feds and from the state that the vaccine numbers will be increasing by at least 20%. And so we're pretty confident that we'll be able to push in order to get enough vaccine to be able to continue doing this.
Where the mercury is?
Hi, good morning, Dr. Smith. Today, of course, is about baby boomers, but I need to ask you about another age group. There's so many parents and coaches in Santa Clara County that are making a big push to play high school football this academic year, and they need to do it. They need to start by the end of this month. What would it take for the county to allow that to happen?
I think that's a question for Dr. Cody.
Thank you for the question. I just want to clarify that the state has rules that we must follow, and they have set out which sports are allowed under which tier. Santa Clara County, like most counties in the state, are currently in the purple tier. There are only a limited number of sports that are youth sports that are allowed in the purple tier, and football is not among them. And so we cannot allow sports that the state does not allow. The sports that the state does allow, we, of course, do allow. We are aligned with the state in that respect.
ATVU?
Do you have a timeline of when you're actually going to implement this?
The timeline for the no wrong door, 65 and up, we worked with our partners yesterday. We are announcing it today. And so it may vary a bit by system. Certainly in the county system, effective today, anyone may make an appointment. And I think that the other systems are, putting procedures into place so that they can also accept any patient regardless of system.
ABC?
How far in advance do you know if you're receiving doses? And how long do you anticipate it will take to vaccinate the whole county?
We receive every week notification from the state as to our county allocation. So once a week, we get a number, and then that county allocation goes to the various health systems in our county. I want to clarify that that county allocation is just the doses that flow through the county, not the doses that flow through the state pipeline or the federal pipeline. I just want to emphasize this is an incredibly complex allocation and distribution system.
KPIX?
Good Dr. Cody, you kind of anticipated my question in some ways. I mean, we know that the distribution system, that the feds give some out, the state gives some out. To the extent that that's caused problems where people have scheduled appointments and those appointments had to be canceled, do you think that the system needs to be rethought where you guys become sort of the central clearinghouse for vaccines coming into the county and distribute them as you see fit?
In the county, we only have control over part of the system, and our job is to make it as clear and consistent and barrier-free as we can. And that's why today we're announcing this no wrong door approach in collaboration with all of the large systems across the county. So anyone who is 65 and up, doesn't matter where you go to get your medical care, you can register and get vaccinated. A Kaiser patient can come to the county, a Stanford patient can go to Kaiser, a county patient can go to Stanford. It doesn't matter. If you're 65 and up, we want you to get vaccinated. Please sign up and get vaccinated.
Final question for the work radius?
I think, I'm good.
All right, good.
Thank you all. And with that, we will proceed to statements from the podium in other languages, starting with Dr. Dayani Nuales-Percy from the Division of Hospital Medicine with Santa Clara Valley Medical Center. Thank you very much, Dr. Nuales-Percy.
Hola, buenos días y gracias por estar todos acá. Hoy estamos aquí para anunciar que el Condado de Santa Clara y el Sistema de Salud de Santa Clara va a comenzar a proveer las vacunas para todos los residentes de nuestro condado que sean mayores de 65 años. No importa si son pacientes del Kaiser o si son pacientes de PAMF, no importa quién sea el proveedor de salud, nos pueden venir a la clínica de nuestro condado y recibir la vacuna contra el COVID-19. Como doctora del Hospital de Santa Clara Valley Medical Center, yo he visto cómo esta enfermedad ha impactado tanto a nuestra comunidad y en particular a nuestra comunidad latina. Y por eso es muy, muy importante que todas las personas que sean elegibles para recibir esta vacuna, que por favor traten de vacunarse. Es una vacuna segura, es gratis y es bien efectiva. Por eso le pedimos a toda nuestra comunidad latina que llamen a los números de información y que se comuniquen para que reciban esta vacuna lo más pronto posible. El número de información es el 408-970-2000. De nuevo, 408-970-2000. Si usted es mayor de 65 años y vive en el condado de Santa Clara, por favor, llame estos números y de esa manera pueden hacer una cita para vacunarse. Muchas gracias.
Kính thưa quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Kính thưa quý vị, ngày hôm nay quận hạt Santa Clara đã có một buổi họp báo để đưa đến cho quý vị về thông tin về việc hệ thống y tế, hệ thống bệnh viện của quận hạt Santa Clara cùng với những cái cơ sở y tế khác sẽ bắt đầu tiêm chủng cho tất cả các cư dân từ 65 tuổi trở lên. Có nghĩa là nếu như mà quý vị từ 65 tuổi trở lên, quý vị có thể đi bất kể những cái hệ thống y tế bảo hiểm nào ở trong cái quận hạt, thì chúng tôi sẽ tiêm chủng cho quý vị bất kể là quý vị có bảo hiểm y tế hay không, hay là bất kể là quý vị có đi cái bảo hiểm y tế của quý vị là thuộc cái hệ thống bảo hiểm nào, thì chúng tôi cũng sẽ chủng ngừa cho quý vị. Quận hạt đang cố gắng bảo đảm những cư dân dễ bị bệnh nặng và tử vong nhất có thể được chủng ngừa COVID-19 nhanh chóng và kịp thời. Theo như thống kê thì 81% trường hợp tử vong liên quan đến COVID-19 là những người từ 65 tuổi trở lên. Vì COVID-19 vẫn tiếp tục lây lan trong cộng đồng và chúng tôi có một cái nguồn vaccine rất là hạn chế, nên chúng tôi đang cố gắng ưu tiên cho những cư dân có rủi ro bị bệnh nặng và có rủi ro tử vong cao nhất trong quận hạt để họ có thể được chủng ngừa dễ dàng hơn. Quận Hà cũng đang lo lắng về việc là mở rộng tiêm chủng cho nhiều người hơn, bao gồm cả những nhân viên đang làm việc ở tuyến đầu và những người đang làm trong ngành giáo dục, để họ có thể được chủng ngừa, bởi vì bây giờ trường học cũng đã bắt đầu mở cửa lại rồi. Thì ngay khi mà chúng tôi có được nguồn thuốc chủng ngừa cho phép thì chúng tôi sẽ cố gắng đưa đến những cái thông báo sớm nhất để quý vị có thể được đi chủng ngừa. Chúng tôi cũng đang tiếp tục cố gắng đưa ra thông tin, tài liệu về Covid-19 và thông tin về chủng ngừa Covid-19 đến với những cộng đồng dễ bị tổn thương nhất. Chúng tôi cũng đang tiếp tục hợp tác với các tổ chức cộng đồng và tiếp thu ý kiến của các cư dân trong cộng đồng để chúng tôi có thể có được những cái chiến lược tiếp cận quý vị hiệu quả hơn. Thêm vào đó thì chúng tôi cũng đang tìm và lên kế hoạch mở rộng chủng ngừa tại các trung tâm y tế và trạm xá ở East San Jose và ở Gilroy để đưa đến chủng ngừa nhanh nhất và gần nhất cho tất cả mọi người. Chủng ngừa Covid-19 an toàn, dễ dàng và hoàn toàn miễn phí, và hầu hết ở các địa điểm thì quý vị phải đặt hàng. Tất cả những cái thông tin về việc chủng ngừa Covid-19 thì quý vị có thể tìm thấy tại sccfreevax.org. Nếu như mà quý vị có vấn đề về Internet, quý vị không có Internet, hoặc là quý vị có vấn đề về việc đặt hàng chủng ngừa Covid-19 thì quý vị cũng có thể gọi cho cái đường dây điện thoại của Valley Connection là ở số 408 970 2200. Ly xin nhắc lại là 408 970 2000 để được giúp đỡ, và có nhân viên tiếng Việt nói tiếng Việt sẽ có thể trò chuyện với quý vị. Thành ra là nếu như quý vị là những người hội đủ điều kiện thì quý vị hãy gọi cho đường dây này để được giúp đỡ. Xin cảm ơn.
大家好，我是圣塔克拉拉县紧急行动中心的 Anchen， 在此提供这周的新冠疫苗更新。县府官员今天宣布，不论您是隶属哪一家保险或是哪个医疗系统，县的卫生系统还有全县其他几家疫苗提供方将开始为65岁或以上的县居民提供新冠的疫苗。由于复杂的疫苗分配系统加上疫苗供应的短缺，导致一开始呢疫苗的推出就不够平均。而这个无误门就是 No Wrong Door 的这个系统呢，是为了保护县内最容易因为新冠病毒而转为重症或死亡的居民，让他们能够更容易而且更快速的接受疫苗。在圣塔克拉拉县内有81%的跟新冠有关的死亡是发生在65岁或以上的群体，因此我们必须优先为这些人士施打疫苗。而县政府的医疗系统也深入了地方，与受新冠影响最大的地方社区中心合作，提供新冠的资讯、资源，还有疫苗给当地的民众。想要了解更多疫苗的讯息，还有登记打疫苗，请上县府的疫苗网页 sccfreevax.org， 可以选择中文的页面。如果需要协助来登记打疫苗的民众，也可以打电话到圣谷医疗专线，是408-970-2000，408-970-2000。与此同时，不管您是否已经打了疫苗，请大家继续采取措施来减少病毒的传播，包括尽可能的待在家里，出门的时候戴口罩，限制和同住一起以外的家人朋友聚会，与他人保持至少6英尺的身体距离，还有经常的洗手。最后呢，轮到您打疫苗的时候去打疫苗。祝大家平安健康，谢谢。
Magandang umaga po. Ako si Ted Gomez, ang inyong tagapaglingkod na Public Information Officer ng Santa Clara County. Ngayong umaga, ang mga opisyal ay nag-anunsyo ngayon na ang county ng Santa Clara Health System at marami pang ibang mga provider ng bakuna sa buong county ay magsisimulang magbigay ng COVID-19 ng mga bakuna sa lahat ng mga residente ng county na 65 o 65 taon o mas matanda. Anuman ang kanilang healthcare provider o ang insurance. Ang walang maling pinto na sistema ay dinisensyo upang matiyak na ang mga residente ng county na pinakamahina sa malubhang sakit at kamatayan mula sa COVID-19 ay maaaring ma-access ang mga bakuna na mas mabilis at walang patid. 81% ng mga kaugnay ng pagkamatay ng COVID-19 sa Santa Clara County ay naganap sa mga individual na edad na 65 o mas matanda. Ang pangako ng county sa katarungan at pagtiyak na ang mga komunidad na pinaka-disproportionately na naapektuhan ng COVID-19 ay may access na impormasyon, mga pagkukunan at mga bakuna ay patuloy. Ang county ay nagsisiyasat ng mga lokasyon para sa mga bagong lugar ng pagbabakuna, magpapalawak ng kapasidad, kabilang ang mga lugar na may sentrong matatagpuan sa mga naapektuhang komunidad sa Gilroy at East San Jose. Ang mga pagsosyo ng county sa mga klinika ng mga komunidad upang matiyak na maaaring ma-access ng mga residente ang mga bakuna ng mga kapaligiran ng komunidad at pagsisikap na susuportahan ang mga paglaan ng mga bakuna sa mga kritikal na kasosyo na mapapagpatuloy. Ang county ay patuloy naggagana sa mga kasosyo sa komunidad at mga stakeholder upang galugarin at isigawa ang mga makabagong at mga estrahiyang na nakasentro sa komunidad upang magdagdagan ang pagpapaagabot ng bakuna. Para sa libreng pagsusuri ng COVID-19, kakailanganin mo magparehistro para sa patient ID. Ang pagsubok na walang mga appointment ay maaaring makuha kung ang espasyo ay nagbibigay daan. Upang magparehistro at mag-book ng mga appointment ng maaga, tumawag sa 1-888-9634-1123, again, 1-888-634-1123, o bumisita sa ihi.care/COVID testing o sccfreetest.org. Ang pagsusuri ay libre, ligtas, madali, kumpidensyal, at hindi nakakaapekto sa katayuan ng iyong imigrasyon. Para sa karagdagang impormasyon, maaaring pumunta sa website ng county at sccgov.org/coronavirus. Isa pang muli, www.sccgov.org/coronavirus. Maraming salamat po.